Before Biden's visit, this bridge right here collapsed in Pittsburgh, causing several vehicles and a bus to crash down into a ravine. 10 people were hurt and 3 of them were taken to a hospital. All of those injuries were minor and some of them were first responders who slipped and fell. There were 3 to 4 vehicles, including that bus, on the bridge when it collapsed. Crews had to rappel down the ravine about 100 feet to rescue people. It is unclear if anyone was under the bridge at the time of the collapse. Now, Michigan, like Pennsylvania, has hundreds of bridges in bad shape. We did some digging tonight and looked into how many bridges in mid-Michigan need repair. There's lots of them. The state of Michigan has total 6,726 bridges. According to the state, 1,230 of them are in poor shape. Genesee County has 46 bridges in poor shape. Saginaw County, 57. Midland County, 20 that are in desperate need of repair. And Bay County has 22 bridges that are classified as being in poor shape.
The CDC says those 18 and younger who have had COVID-19 are at risk for developing diabetes, and experts find those affected are receiving their diagnoses less than 30 days after their COVID infection, and they're more likely to get it than those who have not had COVID. Mid-Michigan Now's Remy Murray is live in studio with more on this for us. Good morning, Remy.
Good morning, Mike. According to Dr. Bobby Mukamala, those 18 and younger are getting type 1 diabetes. This is when the pancreas stops making insulin, and as Mukamala tells me, it is more severe. Mukamala says those coming into the hospital aren't aware they've developed diabetes, so Mukamala says they're coming in with DKA, or diabetes ketoacidosis. This is where a patient's level of sugar is so high it is potentially damaging to the tissues. Mukamala says if you are a parent and your child has COVID-19 and is experiencing signs of increased thirst, lethargicness, or overall abnormal behavior, you should notify your doctor because these symptoms are more severe than a common cold.
We don't see an uptick of 30% in the incidence of diabetes in kids from a common cold or a flu. And so it's just one more piece of evidence that we need to take this more seriously than we do those other types of infections.
Dr. Mukamala says it's not inevitable that we are stuck with this concerning trend. He says once the infection rate goes down and fewer infections are happening, then we won't be seeing as many impacted.
Study from the CDC that shows those 18 and younger who have had COVID-19 are more likely than those who have not had it to develop diabetes 30 days, less than 30 days after infection. Local pediatricians tell us they're seeing similar data here. Mid-Michigan Now's Remy Murray is live in studio with us with more on this. Good morning, Remy.
Hey, Mike. Dr. Bobby Mukamala says it's too early to know why this is happening, but it is going on because now that those 18 and younger are more likely to get sick from the Omicron variant. Mukamala suggests it could be from the inflammation that's associated with the viral infection in COVID-19. But again, he says this is a potential theory as more data is being studied to understand the exact cause and effect relationship. While this data is very concerning for parents, Mukamala says it can be prevented. He believes the safest way is to get your child vaccinated, but at a minimum, Mukamala says masking up and practicing social distancing will help too.
There are always kids that get diagnosed with diabetes that end up in the hospital. But that number is now 20 to 30% higher in this past year based on some data. And from what I've heard from local hospital physicians that are seeing patients, pediatric patients in our local hospitals, they are corroborating that. They are seeing the same thing here.
MDHHS also reports 173 new deaths, bringing the total lost in Michigan to 29,778. Updated numbers will be released tomorrow afternoon, so we'll keep you posted. Starting tomorrow, masks are no longer mandated at Clio schools. The district is making it optional. Earlier in the month, the Genesee County Health Department decided to leave it up to districts to institute their own masking requirements or drop them altogether. Mid-Michigan Now's Justin Dirks went to Clio and spoke with parents.
So I think it should be a parent's choice.
Most of the parents I spoke with in Clio are glad the district is ditching its mask policy and making it optional.
I have 3 kids in school, and I don't want any of them required to wear a mask in school.
Mark, another Clio parent, agrees that masks being optional is a good thing for students.
Not have my kid wear a mask, because it should be up to you whether you want to wear a mask or not, just like the shop.
Yeah.
It shouldn't be mandatory.
Okay.
Just like anything else. You know, you have You have the choice whether you're going to get the flu shot or whatever shot or anything, so it shouldn't be mandatory whether you get a vaccine or wear a mask.
The CDC advises wearing N95 masks to slow the spread of COVID-19. One parent told me she is in favor of students and staff wearing masks in school.
But I think the mask is the only way. Teachers can talk louder and so can the students, but we got to stop the spread. If the parents wear the mask at home, I don't believe the students will mind wearing them. I have young nieces and nephews and they wear their masks to stay safe.
While this mother believes masks should be worn in school, she also agrees it should be a choice, not a mandate.
But if they don't want to keep the spread down, then homeschool your kids.
According to MDHHS data, COVID case rates are increasing rapidly right now among 5 to 18-year-olds. Cases are among the highest in high school and middle school kids, followed by elementary school kids.